discuss. I'm sure I'm happy to take your questions too difficult so that I can answer.
Okay, lovely. So now we see, let us divide this into several parts. To start with, let us start with the first topic being, Kavita, are you there? Can you hear me?
Yes, yes, I can hear you.
Is Preeti ma'am here? Mrs. Preeti Mahendra, is she here? I had requested her to join in also because there'll be so many questions coming up so that she can help us in arranging them so that there is no repetition. We want to make it a little more organized for you. Is she there? I don't think. Let her come in anytime. Anyways, so what we do is we start with first topic being gas problems in Calcutta. So that is a major issue. In Calcutta, we have gas. I don't know what is this gas subject. So to start with, the first question that we would like to know is, what is this gas problem? What is this actually gas problem?
So I tell my patients that if anyone had a cure for gas, then he will probably get a Nobel Prize. So I think it's something which we find very, very difficult to handle at times. Usually it is not a serious condition. I think that's the most important thing to say. So what the patients will experience, a lot of bloating after eating, a lot of belching. Some people will experience nausea and a discomfort in the tummy. And that's often described as gas within inverted commas symptoms. So it's one of the commonest symptoms which any doctor will see in Kolkata. I don't know whether that answers your question.
Yeah, it's fine. So basically we identify this gas problem with the symptoms that you are saying. And why does it happen? Why do we have such gas problems?
So there are mainly three factors. As I said to you, usually it's not very serious. There are mainly three factors. One is dietary.
Okay.
Second is sedentary life, lack of exercise. And third, often psychological. Often stress, sort of depression can lead to this also. So if I come to diet first, that for everyone, every food is different for everyone, how your body reacts to it. So certain food will trigger. So you'll often hear that people will say, if I have milk, I'll get very bloated. I'll get a lot of gas formation. So a lot of excess fiber if you're taking. Fiber is good for you though, but sometimes beans, carbonated drinks like Coca-Cola's, Thumbs Up in excess, they all can trigger gas. Not in all patients, but in some patients. That's one factor. Second is exercise is very important. So if someone is exercising on a regular basis, their stomach emptying, intestinal emptying will also improve. So lack of exercise, gaining in weight often can exhibit symptoms. And last is stress. So if anyone is stressed on a regular basis, and you will see often that when the people are stressed, their gas symptoms get worse. So stress, socioeconomic factors can often, so these are the main three factors which usually triggers it.
So like you said, the first is diet, the second is the stress, and the third is the sedentary lifestyle. Yeah. Now in the diet part, you said if we have high fiber also, high fiber can also cause gas, right?
Yeah, so as I said to you, it's different for different people. So if one has got constipation, high fiber is good for them. But if excess fiber intake is causing too much bloating, so the fibers are of two types, soluble and insoluble fibers. So it depends on what kind of fiber you're taking. It often can trigger, but I will get more stress on exercise, watching out for food, which is making things difficult, and stress, try to avoid. It's easy to say, difficult to do.
So, but then there are cases, like there could be a particular case who has a constant gas. Hi, Dr. Mahindra, Mrs. Mahindra is there?
Yeah.
Okay. Can you please take her as a host too?
Yeah, already done.
Okay, fine, lovely. Well, welcome on board, Preeti ji. I think she's muted. Hi. Welcome. So you'll have to help me with the question because I'm not so medically fit. Yeah, I can't hear you. You're on mute. Okay, fine. Good. Medically fit, mentally. Okay. Now
I will surely do that. I'm here.
Thanks so much. Okay, going back to Dr. Saab. Can we go on Dr. Saab, Ravi? Okay, Dr. Saab. Now what I was trying to understand, you said that the gas problems are there despite having. Now, what do you think is the best? Suppose somebody's gas problem is consistent. It's not stopping. It's going on. It's repeated. So what kind of food that he should have so that that can be at least minimized?
So as I said to you, I think normal dietary habit is important, but watch out for any food if it's triggering it.
Okay.
As I said, a lot of excess carbonated drink, which I often see, we don't take history often. So someone is having sort of fizzy drink on a regular basis, that can sometimes trigger it. Some people say too much excess of coffee can trigger it. Beans are something which can also sometimes trigger it. So it varies from person to person. And the common thing which I often see is the milk. Milk is one of the factors which often people will say, I have milk and I'm getting a lot of discomfort. Saying that, I never say no to milk. But milk is probably the only source of calcium we have got. So that's quite important. So milk and milk products, we need to balance and think about. But it is all individual problem. So you have to watch out for the food you are taking and what you can tolerate and what you can't. So that's something to look out for.
And then when to seek help? When is the right time to go to a doctor to cure this problem? What is that deadline?
So there are two factors here. One, if you are not able to manage your symptoms of gas, discomfort, bloating, belching on over-the-counter medications, simple things like ranitidine, famotidine not helping you, then you probably should see a doctor. But there are certain worrying signs which you need to look out for. So for example, if someone is not able to swallow properly, if someone is waking up at night having a lot of symptoms, if someone is losing weight, or if someone is getting severe abdominal pain or cramps, then I think, so we say there are certain worrying signs which we should not ignore and probably consult a doctor earlier rather than take just over-the-counter medication.
Okay, so, and then what does it lead to? I mean, perpetual disease. I mean, constant somebody suffering with gas. What is the next stage? What do they go to? What is the next disease they have to face?
So what happens is what I said to you about the warning symptoms. So if someone is losing weight, someone is unable to swallow, someone is having pain. So there's a chance that we are missing small ulcers or inflammation in the intestine or esophagus, what we call esophagitis, gastritis. So we might be missing some ulcer or something. There's also a bug called Helicobacter pylori. This is a long name, which often is waterborne, stays in the stomach, and can cause all these symptoms. So if someone is having the symptoms, it's often better to test for this infection also. So if you can sometimes get rid of the infection, your symptoms improve. So someone who is having persistent symptoms or worsening signs should see a doctor. We look out for any infection, any ulcer, and in extreme cases, whether in early signs of malignancy also. So there will be some cases where they're having persistent symptom for a long time, have lost weight, have ignored it, and you suddenly do an endoscopy and find a small tumor. So these things are not uncommon. So the things to look out for are the worrying symptoms. But again, I want to say that simple gas problems usually are not serious and usually it settles down with simple treatment.
But then if they keep coming back, we should consult a doctor. That's how we should.
But they tend to come back. That's the problem. So as I said to you, that if someone had a treatment for gas which will go forever, you won't have to go to the doctor ever, then he's going to be the world famous. So there is no complete cure for any sort of what we call dyspepsia or gas symptoms. But there are medications to control it, but the lifestyle is very important. So if you have a good lifestyle, what we just discussed, will definitely improve your symptoms to a great extent.
Okay. Now, then there are three terms that we commonly hear. One is gas, the other is acidity, and the third is acid reflux. Are they all different or they are similar connected?
So they are all very connected. So gas is something that we just discussed. Acidity, again, there are a lot of people who will have sour taste in the mouth and sensation of heartburn. So what they're having is, they're having some acid leaking through the stomach up to the esophagus and causing the discomfort. Reflux is something different. Reflux, what we discuss, is called volume reflux. That means you are having a sensation of food coming up. So what that means is there is some muscular weakness at the junction of esophagus and stomach, and the food coming up, that's called reflux. And acidity is purely sour taste in the mouth and heartburn. But they're all the same spectrum of disease, what we call dyspepsia or GERD.
So they all come in this gastric issue, or what do you call it?
Yes. So the medical term is dyspepsia.
Okay.
And also we call it as GERD, so gastroesophageal reflux disease, GERD. So that's often also described. And if the symptoms are persistent and no cause is found, we call it non-ulcer dyspepsia. The patient hasn't got the ulcer, but the symptoms are there. You have probably heard of this condition called irritable bowel syndrome. So dyspepsia is like an irritable bowel syndrome of the stomach. So it is, if you can compare, so stomach involvement is like dyspepsia.
That again is triggered by the same kind of three factors, the diet and whatever you said.
Yes, diet. So lifestyle is pretty important. Sorry, yeah.
So all the three things, gas, acidity, and acid reflux are all triggered by these three common factors.
Yes.
Now, do you have a cure for them at home? I mean, is there a cure other than serious medication? Can be cured with home remedies?
So what I say to all my patients is lifestyle is very, very important. So if
apart from these, something which you feel is the only cure, no.
So you see, very simple. You can buy over-the-counter antacids. You can try them if it's helping you. You can buy over-the-counter. Previously it was ranitidine. Now you can get famotidine. Those kinds of pretty safe to take. But if they are not controlling your symptoms, it's best to see a doctor.
And then they continuously.
Sorry.
I'm sorry, sir. You can continue.
So as I said before, it's very important to keep in mind the worrying features. So worrying features like persistent pain, weight loss, unable to swallow, bleeding, any evidence of vomiting which is continuing, those are the worrying symptoms. So if people have any worrying symptoms, they should consult someone urgently. Because gas, as I said, in majority of cases are okay. They're nothing very serious. But if the worrying symptoms are there, then you need to consult someone.
Okay, so we have this now. We have now reached to a borderline. If you have these symptoms which are not normal, you should go for consultation. Now, one question that has come up is these antacids that you are saying we can have from outside. A constant usage is also harmful?
It's a very, very good question. You see, simple antacids which you get, the liquid gels, they are not harmful. Okay. You can take them quite easily. What's harmful is, what people take on a regular basis, like pantoprazole, pan-40. That's the commonest which we get. Okay. So strong antacid medications, which we sometimes give for a short course, pantoprazole, omeprazole, they're all the prazoles, esomeprazole. If you are taking this for a long time, for example, for months, people take for years, sometimes they cause the problems. What are the problems? The two main problems which we're seeing now is problem with the bones. Because of this long-term acid suppression, there's less absorption of calcium and vitamin D. And in the long term, that can affect the bones. That's number one. There are certain case reports of kidney damage due to long-standing use of this strong antacid medications. There is probably increased risk of infection because acid is also good. Acid gets rid of a lot of infections. So if you are getting constantly suppressing acid, the risk of infection also goes up. And there is a very, very small risk. The risk is there of cancer if you're taking long-term antacid medications. However, there is a group of patients who will need it. So it's a balance. Who absolutely needs it and who can try and tail it off. So what I always do, some of you will know, that I start with the dose and then try and cut down the dose. And the guideline is the minimum possible dose required to control your symptoms. So I repeat it again, minimum possible dose. So we should always try and cut it down. And that's how you can prevent the complications long term.
So that means antacid is also not very healthy for the long term. Okay, can we have questions?
Then the thing is, antacid, meaning the antacid gels, yes, are much easier, and it's not that you don't need to worry about that. I'm talking about the medications which we give.
Okay. Like pan-40 and others.
So we see that every time antibiotic is given, doctor prescribes antacid also. Antacid is the pen days normally prescribed. So is it, if there is no problem, is it important to take a pen day with the antibiotic?
There are two parts to the question. First of all, a short course of Pandy is okay. So if you're taking a Pandy for 4 weeks, 6 weeks, doesn't matter. But if you're taking it on a long term, then that we should think about stopping it as soon as we can. Regarding the use of antibiotics and Pandy, I usually won't subscribe any antibiotic, any Pandy with antibiotic. But what happens is, whatever medication you get, people tend to get what we call gas or dyspepsia symptoms. So often the doctors will give you a short course to cover that period of antibiotic. So that's often done, but it's often not necessary all the time.
Okay. Preeti ji, are you there? Preeti ji, are you there?
Yes.
Okay. Would you like to ask questions? Can we have focus on her?
Yeah.
Yeah.
Hi,
Please ask.
Debasis.
Hi, Preeti.
Hi, Dr. Debasis. Hello.
Hi.
How are
Hi.
you? Yeah,
Good to
I
see
was
you.
just asking one thing which actually have been bothering me because I keep on asking this. You know, we have certain habits from childhood, especially in my parents' area or whatever, to take a lot of water between the food. And it is said that, you know, the gastric juices get very diluted, so it does not help in digestion. And even you eat very little food, you feel bloated after having any meal if you take lot of water between the meals. So is it just a norm or it is really true?
So, Preeti, I am very scared to say anything against what the
Please, please.
They are always right. They're always right. But I wouldn't suggest taking water in between meals. You see, I think what happens is you're filling up your tummy and you are actually not able to eat as much as you should. So there's a bit of bloating because of that. So I tend to say that do not drink water when you are having food. You can have it before or after, but not during the meal. Does that answer your question?
Yes, it does. I know the fact, but actually I can't help it. So that's it.
That's true.
Thank you. Thank you so much. Yeah,
Okay, we have some questions on the chat box. Is anybody following?
loads of questions.
Yeah,
Yes.
could you please ask?
Yeah. Right now, the question is, fever started with stomach pain. Later pains subsided, but fever persisting. What it indicates?
I think it's probably is unrelated. You see, I think fever only with stomach pain. If you are having fever, then it is you will have some bowel GI disturbances also. So it's probably unrelated. What often happens is you get a fever, you're feeling unwell, and because of the feeling of unwell, you will get some excess acid secretion or gas formation, and that causes the discomfort. It's the other way around. So probably the infection triggering your GI symptoms.
Okay, sure.
So, is the person here on board? Can he ask? Would you like to ask a proper, more up to the point question, please?
Yeah.
This question is not very clear. If he is on board, he can straight away ask. Okay, over to the next question. I think
So can I start now?
Yes, please, and please keep stick to this gastric issues only.
Okay, yeah. Some set of people say liquid should be taken. Like the same question I just asked.
Okay.
The meals to help digestion, but others say intake liquid after 30 minutes of meals. Opinion? What is your opinion? So I think you already gave an answer for it.
As I said to you, I think best not to take between when you are having food. That's my view anyway.
Yeah.
Okay. Any more questions you want to directly ask, can please raise their hands on gastric issues right now. We'll go to the next topic later. No other issues to be asked, please. Only gastric issues that we have heard so far. Any particular questions, please raise your hand.
Yeah, there is one question coming up. It's a little different.
Yeah.
Due to a medical problem, my esophagus and gut is tight and narrow. So food moves very slowly in the system. Suggest remedies to improve. I also suffer from GERD due to it and use inclined pillow for survival.
Yes. So I think by narrowing, you are meaning that the food is not moving down as smoothly as it should.
As it should, yeah.
So what happens with GRD, you are getting reflux from the stomach going up to the esophagus, and that causes inflammation of the lower esophagus. And that slows down the propulsion of food through the esophagus. So what's very important, I think if you're having a long term, you should have an endoscopy. There's no doubt about it. Because if there are changes due to GRD, you will need this acid suppressant tablets long term, unfortunately. And sometimes we add prokinetics. Prokinetics meaning some medication which helps in the movement of the esophagus. So you should probably have a look, if you haven't had it already, to see how big the changes are in your acidity.
Okay, fantastic. This very interesting question again. How to distinguish between a gastric induced chest pain and a cardiac related chest pain? Is it any? It's a very interesting question. Yeah.
It's a very good question. It is a very good. This is one condition when the cardiologists get the priority. So if you're having any chest pain, a lot of people will actually say maybe it's just gas, just acidity. Do not ignore it, because you are probably might be missing an angina.
The main thing.
So I think if not you personally, but anyone having this discomfort, you've got to see a doctor, at least do an ECG, make sure there's no cardiac issue. Once the cardiac issue is sorted out, then you can look for treatment for GERD or acidity.
Yeah, thank you. There's another question coming up. What is the reason of colitis?
I think we are dealing with the gastric issue, but I'll take
Doctor, you can answer this question. Let's all have stick to this, otherwise thoda gadbad ho jayega. Ritu, can I take over?
Yeah, please do.
Okay. Yeah. Ritu Gupta ji, you raised your hand. Would you like to ask?
Yes, I have a question. My son is 23 and he has having a lot of boils on his skin. I just wanted to know whether it is related with stomach.
Your audio is not audible. You are not audible. Are you audible?
Okay, just a second. I'm saying that my son, he is 23. Okay?
We can't hear you. Can you hear him, doctor?
I just heard he's 23.
My son is 23 years old.
Yeah.
And he's having a lot of boils in his skin, in his face, exactly. So is it related with stomach problem or something? Is it related with some liver dysfunction or something?
Liver dysfunction can cause skin disease, but at that age is very, very uncommon. Acidity gas won't cause pimples. So I think if too much, you should see a dermatologist and get it. It's very unlikely to be liver disease. Very unlikely.
Okay, it's very unlikely. Okay, it has to be something related with skin. Okay. Thank you so much, doctor.
Can we please stick to gastric? Otherwise, things will go haywire. Aditya ji, if you have a gastric related issue, please come forward. You've raised your hand. Aditya, you have raised your hand. I think he's off. There's an iPhone request for raised hand.
One question on gas, please.
Okay. Can you please ask? In between, there's a question. Intermittent fasting, long hours of fasting, does it cause gastric issues?
I don't want to answer this question. So you see, this is big now, intermittent fasting, and I think a lot of people are actually saying they're going to wait and get. But if you look at it physiologically, with the intermittent fasting, there is a chance of people who have got gastric issues will have increased symptoms of acidity and what we call dyspepsia. But it's being used on a regular basis now, and most people are actually doing reasonably well.
Okay. Pavan Dhanuka, you were there. You had a question to ask. Why don't you ask? Pavan Dhanuka.
Hello.
Yes, please ask.
Hi, sir. Every time after pranayam, yoga, or walking or jogging, I have a lot of gas. And in usual time, I do not face this. Only at the time of these activities. Is it natural or something needs to be done?
No, I don't think you need to worry about it. But do not stop any exercise. I will never say to stop pranayama or yoga.
In fact,
that's very
the gas is too high at that time.
It can happen, I guess. But again, I think it's probably some sort of exercise is triggering it. Maybe you can try different sorts of exercise and see if it happens. But I will.
Please go mute. Please go mute. Others, please go mute. Yeah. Sorry.
I will always advise you to continue on the exercise. Maybe try different kinds of yogas and see if that makes sense. I won't ask you to stop.
Okay.
My gas problem, can I ask, please?
Yes, please.
Please,
What's your name, sir?
Anup Bhura.
Okay, which is sir?
We usually drink water after about 30 or 40 minutes after the food.
Yeah.
But lately we find, and it was all right, but lately we find immediately after drinking water, we feel a gastric influx. Can you highlight something or can you suggest something?
You are probably getting a bit of silent reflux. You see, what happens is once you are eating, the stomach is full, and sometimes it can happen that you might have some leakage of acid coming up and causing the discomfort. This should This should get better. You can try some simple antacids over the counter and try it, but it should get better. These are minor symptoms which can happen. It comes and goes.
Antacid, where, what time?
Antacid whenever you're getting the symptoms. For example, you're suddenly getting a symptom of reflux, take two spoonfuls of antacid. You should get the relief.
Thank you, sir.
Thank you. Good. Okay, I have a question that has come in. What is ineffective esophageal motility? How to treat it medically and through lifestyle changes? Do multivitamins and antioxidants capsules alleviate this problem?
It is a very common problem, esophageal dysmotility. What does dysmotility mean? So if you understand, once you have swallowed the food, when the food goes down your esophagus or stomach, you have no control over it. So the esophageal muscles are pushing the food forward, right? So what dysmotility means is this muscular movement by which the food is going down becomes slow, regular. Now, unfortunately, there is no medication which will cure it completely. There are a lot of medications which actually works on the muscles and controls the symptoms. So whenever the symptoms are bad, you take the medication or for a month or 6 weeks or whatever. Once it gets better, you stop it. But going back again to my first thing. So again, lifestyle here is again very important. Exercise, lack of stress, these things do help. So a lot of things with these gastric issues are often related to the lifestyle modification.
Okay.
But
any more questions? There's one Aditya who's raised hand. Yeah. Please raise your hand if you have to ask a question. Otherwise, I cannot locate you. Please raise your hand. In the meantime, to the question.
I want to ask a question.
Yeah, please.
How to boost my metabolism?
Okay, that's not gastric related.
No. I'll tell. I think it's a very, very relevant question for all of us. How to stay healthy, almost.
Yes.
I'm tending to repeat myself, but again, exercise, eating on time, do not gain weight, do not drink in excess, and stop smoking. So these are the very basic factors too. And one very important thing also, which I didn't mention before, do not go to sleep immediately after eating. Now, a lot of people will suggest taking vitamins and antioxidants. These can be taken, but if you are leading a healthy life, you should be okay. What we see these days are two factors: is gaining in weight and stress in life. Those things are very important.
Sir, any food which can boost?
Normal food. All food are healthy. Do not have too much oily food on a regular basis. Smoking and excess alcohol are again not very good. Smoking is absolutely no, but all food are good if you are eating healthy diet.
Sir, I'm leading a healthy life, but though I'm getting I'm suffering from severe gastric problem. After eating anything, I just produce gas. I just take burp. So how to stop that?
So you probably will need a course of medication and try, because if you are leading a healthy life, doing regular exercise, I think sometimes you do need tablets, medications for a 2-3 months course. And so if it is continuing, you should probably consult your doctor and take an advice what else you can do.
Another question: sudden bloating in the later part of the evening, sometimes with pain. Is it anything? Sudden bloating?
It's the same thing as I was talking about, a muscle movement. So the stomach muscle are not emptying the food as smoothly as it should.
Okay. So we go to the next topic today now. For now is ulcer. Ulcer is the next topic we are moving on to, because these questions are there already. Mostly the questions are answered. We will still have specific questions separately. Can we all go mute, please? Can we all go mute? Can we all go mute? Mute kar sakte. Okay, we are going to the question is, what is ulcer? Why does it occur? And what are the symptoms of ulcer?
Now, ulcer is, of course, more worrying than any simple gas problem. So the main two reasons we see for ulcer is, one is due to an infection, which I mentioned, Helicobacter pylori infection. So that is an infection which is waterborne. It was actually first discovered in Australia by in 1990s, end of 1990s, by someone called Barry Marshall. But this is a main cause now for gastric and duodenal ulcer, is infection by Helicobacter. That's number one. Number two, a lot of painkillers can cause ulcer. So if someone is taking painkiller for a long duration, that can cause ulcer. And one common culprit which we see is aspirin. Aspirin often causes small erosions of ulcer, but aspirin is good for cardiac patients, for patients with high blood pressure, diabetes. So I'm not asking to stop aspirin, but that's one of the reasons. Number three, rarely though, gastric or ulcers can be malignant also, cancerous. So these are the three broad reasons. One is Helicobacter pylori-induced ulcer. Number two, drug-induced, like painkillers, aspirin. And rarely though, cancer can cause also ulcers. Now, what are the symptoms? The main symptom which you get in ulcer is pain. So if someone is having gastric issues with pain on empty stomach or after eating, they should think it is an ulcer, whether they have got an ulcer. The pain is usually in the upper stomach, not lower. So usually upper, sometimes it goes to the back. But the pain is a predominant symptom of ulcer. And the worrying thing is, if you're losing weight, if someone is losing weight, the pain and loss of weight, you need to take it seriously.
Mute, please mute. Mute kar do.
Did that answer your question?
Please mute. Ravi, can you please help me? Okay, you are. Okay, perfect. Yeah, we can hear you.
Did that answer your question, more or less?
Yes. So the first question is, you said the symptoms of pain. Pain could be at the upper part of the stomach or the back, right?
Upper part of the stomach going to the back, yes.
And what is next? What does the person do? If he gets such pain, he goes to a doctor for testing.
He needs to see a doctor. You see, the pain in the upper abdomen nowadays, we see in many cases there won't be any ulcer. It just might be a gastric issue, gastritis or gas formation. But you need to rule out two important things. One, a stone in the gallbladder.
Somebody is bothering. Manoj ko kar le, Manoj ka. Okay, sir. Yeah. Sorry. You can take some water or something to feel better, sir. You're going on.
Right. Okay. So there are two things which need to be ruled out. One is if someone has having pain, maybe it's not an ulcer. But if someone is having constant pain, especially with meals, with nausea or any vomiting symptoms or weight loss, they should be investigated to make sure you haven't got an ulcer.
Okay. Can we go to the next question? Any questions that you want to ask? Preeti ji, are you there? Preeti ji, are you there?
Yes, I'm there.
Yeah, please. You want to ask a question? Any question that's come to you?
Yeah, there's a question from someone. Is pancreatitis somehow related to indigestion? My gallbladder has been removed in 1998. What food restrictions should I follow?
So there are two questions. Pancreatitis is something separate. It's not related to ulcer, but gallstone can cause pancreatitis and alcohol can cause pancreatitis. Now, if your gallbladder has been operated, I think important thing, there are certain people will get tendency of acidity due to bile reflux. People who do not have gallbladder tend to get it. So again, weight is important. And avoid too much fatty and oily food. Though the gallbladder is not there, that sometimes prevents excess bile formation. So too much fatty, oily food should probably be avoided if people are getting symptoms.
Yeah.
Any more questions?
Sir, what is a fatty liver and how to keep our liver healthy? Is there any superfood through which we can keep our liver healthy?
I think Jiten will come to that topic a bit later, I think. Is that right, Jiten?
Yeah, I know, but they are all waiting to hear. I think you should answer. It's better that way because otherwise they want to know. And you can answer, sir. Please do.
So if anyone has an ultrasound in Kolkata nowadays, you will see 7 to 8 out of 10 ultrasound reports showing fatty liver. Is that right? I think most of people will have.
Yeah, everyone has.
Now, I want to say fatty liver can be an issue, but in the majority of the cases, fatty liver is actually a benign condition. You don't need to worry about it. But there will be a small percentage of patients in whom, if the fatty liver stays for a long time, it can revert to chronic liver disease and even cirrhosis of the liver. So whenever we hear fatty liver, we have to be careful. So 3 factors for fatty liver. Going back to the same thing, keep an eye on your weight. Make sure your weight is okay. So exercise again, trying to get your BMI below 24, crucial. Number 2, make sure that your diabetes and cholesterol, triglyceride levels are under control. So sugar, cholesterol, high triglyceride, they can all trigger fatty liver. And so if someone has got a mild fatty liver, if someone's diabetes is not controlled, someone's weight is very high, and cholesterol is not good, it can progress. And these patients will have problems. Third is drinking excess alcohol. So what is excess alcohol? We can have another discussion on that. But again, drinking alcohol regularly, higher amount in people with fatty liver can cause this. So if someone has mild fatty liver, if he or she is careful about weight, sugar, cholesterol, and alcohol, should be okay. But again, very easy for me to say, difficult to do. But again, that's something which is the advice.
Great. Next question from Harish. Harish wants to know something. Harish wants to ask something.
$48 में लियो ना एक माल आज.
I want to know.
58 में. Same party है के?
Somebody please mute. Somebody please mute.
अच्छा और मेरो माल किने दियो थो? मेरो नाम आलो.
स्केरू माल. इनका माल क्या पता करो भाई. Harish, yeah, please carry on.
Yeah. If we are taking any medicine for the blood thinner and high BP and cholesterol, then there is a chances of the ulcer, what we know. And so the doctor prescribe and one antacid tablet also. And you are telling that antacid tablet regularly if we are taking, that we are on the risk of another problem. Yeah. So what to do in both cases? How to handle this?
It's a very, very good question. You see, what I always say, if you are not having any symptoms of acidity or gas, do not take any anti-acid medication with aspirin. If you are having symptoms, take only the lowest possible dose which controls your symptoms. So there is no solution. So there is no one answer which will fit all. So some patients will have aspirin high dose and have no problem. They don't need to take anything. So it's not a prophylactic. If you have symptoms, and if you had past history of ulcer, if you have any evidence of bleeding, then yes, unfortunately, there is no other option but to take it. It's a balance, so what you need or not. But I won't stop the aspirin unless your cardiologist or heart doctor wants them to.
Let's another topic that is very interesting, which is constipation. Constipation is a huge problem for a lot of people and they do not know how to handle it. They are trying several laxatives which is not working. So first of all, how do we figure out, apart from the fiber food, which I'm sure you'll suggest, a healthy exercise which you'll suggest, excess water you'll suggest, what are the other? Everybody wants an instant remedy. Can you give us a remedy on constipation?
There is unfortunately no definite cure, which I'll tell you when everything gets sorted. Apart from the lifestyle, what I will say is, a lot of people hesitate to take mild laxatives. So very simple things on the market, dufalacram, you hear a lot of them. Do take the laxatives because unless you are taking it, your symptoms will get worse. What we should avoid taking is what we call stimulant laxatives. Stimulant laxatives are habit forming. So the ones in the market, I'll name them anyway. things like Cremalax, Dalcolax, Dalcoflex, those things you should avoid on a regular basis.
Dalcolax, okay.
So you can take it once or twice a week, but do not take it on a regular basis. Now, the good news is there's a new medication on the block called prucalopride, which we have started using it now. And there is evidence.
Please spell it once again. B-L-U-E?
P-R-U.
Yeah.
A-L-O-P-R-I-D-E, prucalopride. So this is something which is beneficial in about 1/3 of patients with irritable bowel constipation patients. So these are new things coming up. One thing also helps is unfortunately not available in India yet. Something called it's available but not freely in Kolkata. Something called biofeedback treatment. So biofeedback is sometimes it's a thing done by the psychologist also to retrain the bowel muscles to help in the bowel movement. This is without any medication. So this is something which will come and hopefully will help. But there is no cure, Jitin, that I can't prescribe one medication which will get rid of it completely. It's again lifestyle, and certain new medications are coming up.
There are a lot of people using Isabgol also, which is also not very effective.
Isabgol, I've got absolutely no issues on it's quite a safe thing to take. The problem with Isabgol is, which I will go back to the first topic, that some people will have bloating, gas formation due to Isabgol because it's the fiber again. Some people do not tolerate that fiber. So a group of patients will have bloating only because of Isabgol. But it is a very safe thing to take. And people who are able to tolerate it, I've got no problem with them taking.
Yeah, because sorry, there's a question coming.
Yeah. One thing I have heard about, if you take Isabgol with the curd, which is a homemade curd, it really makes the symptoms very good. Like it's the best remedy. I don't know how true it is. No.
I have no issues at all, Preeti. I think people, both curd and Isabgol are all very safe things to take. So if it's working for some, no problem.
Yeah. So there are questions coming up.
Please ask.
Yeah.
So just can you highlight on hiatus hernia?
I think so. Yeah. So hiatus hernia is the one we were talking about GERD before. So the tube which takes the food down is called the esophagus when you're eating food, and the esophagus joins the stomach where the acid gets secreted and digestion starts. Now, between the junction of esophagus and stomach, there is a muscle which we call sphincter, which prevents the acid from coming up to the esophagus. Now, what happens in hiatus hernia is this muscle between the esophagus and stomach becomes lax or loose. So, a bit of the stomach creeps up to the chest in the esophagus. So, the stomach which is creeping up, it is the hernia. And that is called hiatus hernia. So, the hiatus means the opening through which the hernia comes up. And the people get symptoms of GERD, what we were talking about. Heartburn, reflux.
Yeah.
Those kind of symptoms. Yeah.
Thank you, sir. Thank you.
One question out of the way. Generally, I've seen in the last few days, we've had so many doctors coming in. How come they maintain so much of patience? You're so calm. You're so calm. You're getting so many questions.
No. People who know me knows that that's not true. But again, yeah, I'm trying to be.
Jesse wants to tell you that how you maintain your gas in your stomach.
No, but seriously, I mean, I'm watching so many doctors that come in, and all of them have the same pattern. They're so cool, relaxed, and they're taking so many questions. I don't know how you manage.
We are seeing patients on a regular basis, so that's how it is. But you see, these are genuine issues. These are not major issues. These are genuine issues. People suffer with it, and unfortunately, medical science is not that advanced. We can't cure many things. We only can cure infections. You see.
Okay, now,
there is one huge misconception among the patients. Whenever the gas forms, they take the Limca and these carbonated drinks. You should highlight on this, sir.
No, I just mentioned, I think too much carbonated drinks, it will trigger more gas formation in certain people. This is a proven fact. Excess coffee also does the same. So I won't suggest to take too much Limca or thumbs up or Coke when someone is having symptoms. You can have it. I'm not saying you can't have it, but do not have it in excess because that can trigger more symptoms.
Okay. Now there is one question that has come up on my message. They're asking that how do you define that constipation? As in, how does one know that he's still constipated? I mean, basically, he may have gone to the washroom.
It's a very good question. You see, concept of constipation is different for different, right? So some people who are not opening their bowels completely, they say they're constipated. Some, when they're opening very hard stool, when they have difficulty in passing stool, they feel constipated. And some people describe constipation as passing incomplete bowel motion. So they are feeling that they are not actually able to open or evacuate completely. So it varies. I think all three can be described as constipation, the way people approach it. So there's a chart you can look on the internet called Bristol stool chart. Bristol means Bristol city in England. So Bristol stool chart, if you go on the internet, you will see the different kind of stool pattern which is described as constipation. But this is in brief what it is like.
Okay, there's a question that's come up on the screen. I can see after morning stool, a lot of gas builds up in stomach. What could be the reason?
Irritable bowel syndrome. That's the commonest reason. What we discussed. So the stomach is, the colon is not getting rid of the bowels as normally as it should. So it's again the problem with the.
Go a little bit on that IBS and IBD. I mean something on that. What do you?
Two completely different things.
Okay.
IBS is not serious. What does it? But IBS is very distressing. IBS people with diarrhea, constipation, or pain suffer a lot because there is no definite cure. But it is not a serious condition. But IBD is a serious condition. IBD means inflammatory bowel disease. Inflammatory bowel disease. And it has got two components mainly, ulcerative colitis and Crohn's. These are chronic diseases. There is treatment, but again, there is no cure. And ulcerative colitis and Crohn's disease may turn serious, even requiring surgery, which is never required in IBS. So IBS and IBD are completely separate. Some people of IBD may have IBS, but it is a completely separate thing. So whenever we get the diagnosis of IBD, usually the patients have had a colonoscopy and a biopsy-proven inflammation of the colon. So IBDs we got to take much more seriously. Saying that, IBS can be quite distressing for patients.
Okay. So we get to hear now that's the difference between IBS and IBD. Although हमको इतना समझ में नहीं आया. Actually, I'm being very honest, but ठीक है.
So IBD, I tell you. So
no. I on a lighter note, just trying to be on the lighter note. Any questions so far? Any questions that you want to ask, please? Please raise your hand. You want to ask any questions? Directly, doctor is here for questions. You want to ask any questions, please?
Sonal Kodhari.
Hi, I have a question.
Yeah, please. Please ask, Sonal.
Yeah. What's the cause of this? There's a lot of burping while sleeping at night. And this happens only in Calcutta, being when my daughter, she's in Calcutta. So what's the cause or reason, for this lot of burping?
Yeah, it's a very thing. A lot of people, it has been very common in West Bengal, not only in Calcutta. So if you see, a lot of people will say that in Calcutta, I get that when I'm traveling outside, maybe abroad or outside Kolkata, we don't get it.
I can't hear you.
Can you hear me now?
No.
Yeah, we can all hear. There's something wrong with you. We can hear very clearly. Doctor is very clear here. Sonal.
Yes, carry on, sir.
It was clear. Okay, I'll try it.
Can you hear me now?
Yeah.
Can you hear me now?
Yes.
So it is very, very common for us to hear that people, when they're traveling outside, their gastric symptoms gets better. I do not know the answer to that. Some people will say that certain food which we eat here or maybe water triggering it. I don't have any definite proof to it. But what the symptoms which you are describing, it is type of irritable bowel or dyspepsia, what we were discussing. Again, look out for any specific food which is triggering it here. If you can identify anything, maybe avoiding it will help.
Okay, yeah. Thank you.
We have Prakash Singhal here wanting to ask. Please come forward. Prakash Singhal.
Yes. Dr. Saab, good afternoon.
Good afternoon.
So, Dr. Saab, what is the reason of causing of this colitis?
So we are talking about inflammatory bowel disease or colitis.
Colitis means that हिंदी में जिसको अपने आँव बोलते हैं, आँव बोलते हैं.
So look, there's the confusion जो होता है ना, हम लोग जो colitis है, that is actually irritable bowel syndrome. ठीक है?
Okay.
Let me explain. Colitis, anything itis means inflammation. So colitis means inflammation of the colon. What is inflammation? If you cut your hand, you will see the hand gets bruised or red. So something like that happens inside the colon. So that is colitis. So colitis are the many reasons for it. One which is very common in India is infection causing colitis. So what we call infectious colitis. And the second thing what I was describing is IBD colitis. So inflammatory bowel disease causing colitis. Third thing which can often also is ischemia. Ischemia, what you heard in your heart, can cause the colon also. Any inflammation is colitis. So it can be infection, it can be IBD, it can be ischemia, it can be due to radiation. There are many causes for it. Am I clear? So that is the different reasons for it.
Okay. Can we have another question from Priyam Budhia ji? Can you please ask?
Yeah, hi. Good afternoon, doctor. I have two questions. One is, what is the simplest and the best medicine to take for one-off gas?
One-off?
Yeah.
If you are taking so for example, if you're going out for a meal, take one pan 40 and go. That's fine. But do not take it on a regular basis. So, so one-off pan 40 or anything like famotidine or anything you can, it's fine. But I always advise not to take it on a regular basis more than a month or two.
Is Digene and Pudin do these things work? Are they good?
Yes. Digene is very safe to take. So if anyone's symptom is getting controlled with a Digene tablet or Digene antacid, is absolutely fine. Not a problem. It's very safe to take. Pudin there are no studies, but again, a lot of people benefit from it and I can't see any problems having it. My only problem is strong dose antacid, which is carrying on for months to years. So that's something which we should try and avoid.
Right. Thank you. And the second question is self-enema safe?
That's a difficult one. You see, as I was discussing, a lot of patients with colitis, IBD, need self-enemas. And they are getting used to it. Yes, it is not unsafe, but at least someone needs to show the person how to take it first. And only one should use it if you're comfortable with it. Because it is sometimes people are not comfortable taking enemas. But it is safe. What's the risk? The risk is a bit of risk of bleeding. So someone needs to be taught first and then take it as long as they're comfortable to take it.
All right. Thank you.
Any more questions from the forum right now? In the meantime, Kavita ji, can you please sum up some questions that are not answered yet so that I can...
Yeah, sure.
Time? Yeah, please. Okay, now going to one question that I have here. Somebody wants to know, is there any specific age or some method of finding out when to go for colonoscopy? Colonoscopy, is it mandatory for sometimes in life or any reason that should understand?
Yes, I think what's happened more and more, especially in the Western world, because the risk of colonic cancer is quite high in the Western world, a concept of surveillance or screening colonoscopy has come in. So different countries say it differently. So if someone above the age of 50 or some will say someone above the age of 60 should have one-off colonoscopy to make sure they haven't got any colonic polyps. Colonic polyps are small growths in the colon. They are benign, they are not cancerous, but if they stay, they can turn cancerous in the long term. They may not. So the concept has come in the Western world where the incidence of colon cancer is more to have a one-off colonoscopy at the age of 60, roughly. Some do just check the stool for occult blood. If the stool shows any blood, then they will go for colonoscopy. So it's either or. But in India, the concept is not there yet. I don't think there is a government policy about that yet. However, what we suggest that if there is any family history of colon cancer, especially at an early age, and if there is any family history of IBD or colitis in the early age, then one should have a screening colonoscopy. possibly after the age of 50 or around 60. So for India, family history is very important. So these are the patients who have got no GI symptoms I'm talking about. This is only for screening. But if someone has got a GI symptom like any bleeding to the rectum or alteration of bowel habit or severe constipation or diarrhea not getting better, they should have a one-off colonoscopy.
Okay, great. We have a question from Sun21, SUN21. Please ask.
Hello, doctor. Actually, my question is neither pertaining to gastric or IBS. It's a very personal question. I had a liver transplant in the month of... hello?
Yes,
Can you hear me?
Yeah.
Okay, sorry. I had a liver transplant in the month of November in Max by Dr. Subhash Gupta. Now, the question here is that since then, all the other parameters are fine. I'm doing pretty okay. Now, the only problem here is that, right below my chest area, I still have a hole from where a lot of bile discharge is coming. It's around 50 ml per day, the outcome. Okay. So, but it's not stopping. I mean, that's the only thing which is really, really troubling me because it's thick. It's got mucus. It's like a mucus consistency and watery consistency also. I mean, the doctors over there at Max are suggesting me that it'll get finished, it'll get settled down on its own. But the others have settled down. The other bile discharge, wherever it was coming from, pigtails and all those, But this one is taking a lot of time. I had a pigtail initially, then a colon bag, then of course dressing. But now the dressing is not able to, hold it. It's increased, in fact, from the past months. So it's around 50 ml per day. Can you suggest something? Because the doctors over there are still just going, well, let it settle on its own, But it's really troublesome. It's been 3 months now for me since, this bile discharge is coming.
I think it will probably settle down, my dear. I think it probably will. It sometimes takes long to settle down. 2 things I would say. I'm sure they have done some scans to see if there's any leaks somewhere. So I think
yes, they've done the MRCP and the ultrasounds and all. As such, at that particular time or something, the collection is hardly of 2 cc or something. It's not really a problem.
You see, there is a tract formation and the tract takes time to heal. The only other suggestion which is coming to the top of my mind is there's no harm sending that bile which you're coming out for culture to see if there's any infection growing there which is stopping it from healing the tract. It's a thought they might have done it already, but what I've seen in
I think they had checked it for PTBD collection or something like that. They were discussing.
So to look for an infection in the bile which is coming out.
Okay.
Because you see, if there's any infection there, then often the tract takes longer to heal. So you might need a course of antibiotic if they haven't given it. It's just a thought. So what we usually do a scan to make sure where the leak is and if the leak is big enough to do any intervention. If it is not, check for any infection. Hopefully it will settle down.
Okay.
Normally, does it take that much time for it to settle down?
I've seen it 6 months.
Wow.
It's not common at all.
Oh,
it can happen. It will settle down.
Okay, thank you so much, Dr. Datta.
Scan was important. The scan has been done. The scan is the important thing because by the scan only they will know how much leak is there.
Yeah, the scan has been done and everything. As such, there is no collection as such over at that point.
It should heal down.
Sun21, are you satisfied with the answer?
Very much. Thank you so much. Thank you so much.
I wish you a speedy recovery, Sun21. You'll be okay soon.
Thank
you. If you need to connect with this doctor, he is very much here in Calcutta. You must connect with him.
I will. I'm in Delhi right now, but once I come back to Calcutta, I would like to really, confirm things with Dr. Datta.
I think they have got a very good setup there. I think you'll be okay.
I know. No, but I am from Calcutta. I had been airlifted for my transplant. I had an ALF basically. So that's why I have to come back to Calcutta post the corona situation. Okay.
All the best. Monica, light to you, son.
Yeah. Okay. So you finally recognized me.
Yeah, very well. Let's move on to the next question. Next question. Kavita, you have more questions coming in?
Yeah, I have few questions.
Yes, please.
It is an usual perception that drinking lemon water in mornings is good, but lemon per se is highly acidic. So should people having acidity take this? Please advise.
No. You see, it's very different for different people. If you are able to tolerate lemon water without causing too much acidity or reflux, I have got no problem at all. But if you are having symptoms, then you should reconsider taking it. It's very individualized. It is not true for, I cannot give an answer that which is true for everyone. Everyone is different.
Next question,
Okay,
please.
one more question. How to make body alkaline in a simple way?
I do not know the answer to that also, but I think lead a healthy life. That's what I would say.
Next question.
Will constipation lead to piles, or is piles a different ailment?
Oh, no, constipation, absolutely right. Constipation can lead to piles. What happens is when someone has got constipation, they're straining to open your bowels, and that can cause formation of piles. So the important thing is to try and take laxatives or any fiber to make your bowels soft and avoid too much straining.
Good question. Next.
There's a question from Ajay Gupta. What is the ideal time to be taken for stool pass?
Sorry, ideal time? Sorry, I missed
What is
that.
to be taken for stool pass?
Ideal time.
Time, all right. Oh, again, it's personal habit. It's personal. I think it's best to have a fixed time. That's the only thing I would say.
Ajay ji, hello. You must carry a stopwatch with you next time. Okay, next question. Next question, Kavita.
Is ice cold water good after meal, with or after meal?
Nothing like that. Nothing like that. It's your own choice. It's your own choice. If you are singing on a regular basis, avoid it. It just might cause laryngitis.
Okay, lovely. Good one. Next question.
Is it true that someone has pain in legs or backache due to gas? If true, what can be done?
No, absolutely not. So I hear this all the time. There is no way anatomically the gas can pass to your legs from your intestine. It's not possible. So what happens is if someone is having too much discomfort in other areas of the body, that can also affect your intestine. And that's an indirect way you can get gas formation. But gas won't cause pain in the leg. It's probably got an arthritis or something else.
Sir, what is the reason of continuous hiccups? Suddenly, hiccups are not stopping at all. You consume Limca, a lot of water, but hiccups are, it keeps on going for 15 minutes, 20 minutes, becomes very discomfort.
So that's very good question actually. Hiccups, there are two main reasons in a normal patient. If you are getting excess acidity and reflux, I think that's something. So if normal medication is not helping, you might need to take a stronger antacid medication. That's number one. Number two, make sure you're not constipated, because if the colon is full of stool, it also pushes the diaphragm. So make sure the bowels are okay and the acid control medication is okay. It should settle down. But antacids are very useful in these cases, which you buy over the counter. They're often very useful.
It is once in a while, that is 3 months. It doesn't stop at all. It is an antacid and everything has been taken. It doesn't stop at all. So in that case, what should be the urgent medication one can go with?
Keep a bottle of antacid with you. Take 2 spoonfuls, 3 spoonfuls, twice or thrice. It should settle down. It does help. And make sure you are taking some laxative if you are constipated.
Okay, we move.
Thank you,
Dr.
Doctor. Thank you very much.
Dr. Sir, I was checking on the time. You are here for almost 1 hour and 15 minutes.
That's all right. You carry on. If you have
Thank
any
you
other
so much. Okay, we have a question from Shashi Modi. Shashi Modi, would like to ask? Shashi Modi would like to ask? Okay, we move over. Kavita, you can ask your question.
I have a question here. In spite of completing the course of I regularly face gastric problems. So is there any permanent cure for it?
No, unfortunately, there is no permanent cure for it. That is the problem with this kind of symptoms. But there are medications which can control your symptoms. And once you're better, try and stop it or reduce the dose. But again, lifestyle. Please do think about whether you can change your diet in some way. If any food is triggering it, just try to find out. And exercise. I think that's very important.
Hello.
Yeah, next question.
Hello. Good afternoon, Doctor Sir.
Good afternoon. Good afternoon.
Why sudden gastric problem in early morning? Sudden, no changes in their dinner, nothing. But sudden gastric problem.
Some people do get it. You know, what happens is when you are sleeping at night, in certain cases, there is acid accumulation in the stomach at the resting place. Some people will experience sudden symptoms in the morning. So you can try taking some light antacid before going to bed at night. And that might help your problem in the morning. Take it for a week or two and you can try it.
Okay. And second question.
Can I jump in?
And second question, why fat? Not fatty liver, but reports so fat in fatty liver. Upon liver, not fatty liver.
Fatty liver where? Sorry, I missed that.
Not fatty liver, but fat so upon liver.
Well, fat seen on, that's another term for fatty liver. I think that's what they're mentioning.
Yeah.
That's another term for fatty liver.
Yeah. Why?
So make sure your sugar and cholesterol are okay. I think that's very important. Make sure they're okay.
Complete okay. No,
And they are okay. Some exercise, you'll be fine.
Okay. Any more? Next question from.
Yeah.
Okay.
Can I join?
Yeah, please join.
Hello, Dr. Saab. This
Hello.
is Neeraj Gupta here. How are you?
Hi, how are you?
I'm fine, sir. Thank you so much. Your patient is in front of me. Sir, I just wanted to ask, sometimes we have a lot of flatulence, suddenly. I mean, it's not a regular feature. Sometimes whenever, suddenly due to some unknown reason or maybe due to having something, we suddenly tend to have a lot of flatulence and we feel quite uncomfortable. We feel some headache or something. So is there anything we should do about it or...
I think if you're getting it, if you have got any antacid, take it, or any medication like famotidine or that, just take one off. I think that will settle it down. It's difficult to predict, but certain foods suddenly trigger it. So any simple antacid or things like famotidine or even pan-40, one off, you can take it and see.
I mean, pan-40 can be taken without empty stomach also, sir?
Yes. You can take it anytime. It works better when you're taking 30 minutes before food, but you can take it anytime.
Thank you so much, sir. Thank you.
Okay, Vikram Kedia, are you there? You can ask, please. Vikram Kedia, please ask directly. Nikhil Talreja, are you there? Nikhil Talreja, please ask your question.
Yes. Good afternoon, sir. So, sir, I'm 32 and I have, sometimes if I have a heavy meal, I have pain on my back and that pain is very severe. Like I have to take pan-40 and hyphenate C continuously for 2 days, and when the reflux passes by, then I'm back to normal. And this happens after a meal, heavy meal, maybe once in 2 months. So what should I do? I mean, is it normal? It's okay. And what should I do? I am high on cholesterol, fatty liver. I take Softovac at night and pan-40 quite regularly.
Check your back, because there is no problem with the back muscles and the spine. Is that you see, the thing I'm asking you is gaseous symptoms can cause pain, but you should not have severe pain in the back. You see.
Sir, I can't. I mean, it's that bad.
Sorry?
I cannot move. It's that.
So my suggestion is at least get an X-ray done of your back to look at your lumbar and sacral spine, and make sure that the disc space are okay. I think you should do an X-ray at least. We should not think it's only gaseous reason. And often physiotherapy helps a lot. Okay. So what happens often is you get spasm, not in the spine area, just the muscles at the side of the spine. It goes into spasm. And that causes this sudden excruciating pain. And we often think it's because of gas, but it might be something else apart from gas which is causing it. Do you work sitting at a sitting posture? Or?
No, sir. My work is quite stressful, and probably my general physician says that it is because of the stress that happens. But I feel whenever I pass the gas, and I'm absolutely fine. Maybe by burping or something, but I'm absolutely fine after that.
Can cause it, but you are probably getting some spasm in your lumbar muscles, which is also making it worse. So maybe at your spare time, show it to a physiotherapist. They might suggest you some exercise which will strengthen the muscles and prevent this problem. This is in addition to gaseous problem what I'm talking about.
Okay, sir. So there's another question actually. Sir, my father is 72, a dementia patient. So, sir, I feel his blood pressure just increases because of the IBS. He's taking Softovac and 2 spoons of Softovac and Cremalex Fin Plus 2.5 ml mixed together. But he's not satisfied with his stool clearance in the morning. So for that, he goes to the loo at least 5 to 10 times. And that takes a toll on his body. So what can be a solution to this?
This is a very typical symptom of irritable bowel, what you just described. So there is this new medication I just mentioned, prucalopride, which is sometimes used to help this condition. So maybe consult your doctor about it. He may be able to give you. So this is something new which has come out. Okay, it is not 100%, but it can help.
So I actually missed it, sir. Can you spell the thing?
It is written in the chat.
Okay, thank you so much. Thank you so much.
Okay, we are now going very close to, because he has to leave also. We'll go very fast through 2-3 topics. One is gallbladder stones. The gallstones are the most stones which are there. There are sometimes stones in the gallbladder which do not give you any symptoms. Now, which we get to know only when we go for a test like a sonography or something. We come to know that we have a stone in the gallbladder.
Right.
So what does one do in that situation when there is no symptom?
So very important, very good question, Jidan. So asymptomatic gallstone, people have got no symptoms. So any patient who has got diabetes with asymptomatic gallstone should consider surgery, because diabetes patients do not do well. So if they have a gallbladder problem, they will have issue. Also, any patient who has got sort of other comorbidities may need to consider it. What I usually say, if someone is elderly, so it's a rough guide. So if someone is above 70, 75, no symptoms, I suggest, non-diabetic, I suggest don't go for surgery.
Okay.
Younger patients, I will tend to advise surgery because they have got longer to live and there are chances of getting complications from...
But if there is no diabetes then?
Sorry?
If there is no diabetes also?
Still, for example, if someone gets a gallstone at the age of 30, so it's probably best to get it done.
Okay.
The other thing to look for is the number of stones. If there is one large stone sitting there, they usually cause less problems. Multiple small stones cause big problems. So I'll give you a scenario. A 50-year-old non-diabetic has got a large stone sitting there, doesn't want an operation, I won't force him. But a 50-year-old non-diabetic again, with multiple small stones, doesn't want operation, I will suggest go for it, because a small stone can slip out and cause more problems, like pancreatitis and stones. So diabetic patients, I will always recommend surgery, though they're asymptomatic. Non-diabetics, depending on the age group and what kind of stone size they have, we have to think about it.
Perfect, got the answer, sir. Kavita, question from you, please.
Yeah, there's one question. When doctor is not available and stomach pain occurs, how to differentiate between stomach infection and muscle pain? What medicines can be taken for it?
So stomach infection is very easy. You will either get a fever or you will get episodes of diarrhea. So I think that's very, very easy to find out. Now, whether it's a muscular pain or not, we do not know. Muscular pain is very difficult sometimes to differentiate from gaseous problem. So you have to sort of, if very simple medications at home, like any antispasmodic you can take or any antacid you can take, but if it's not getting better, you can see a doctor. If you're getting any chest pain, do not ignore it as only a gaseous problem. That's the only thing I would say. You should see a doctor as soon as you can.
Good. I have a question from Rahul Raisurana from Mumbai. Due to spine problems, my father, age 84, is mostly lying in bed. Has developed digestive problems, difficult to pass stool, and urine without medicines, and also gets spasms after every meal. Any suggestion?
I think it's a difficult thing. I think he will need longer medications, maybe stronger dose of antiacid medication and prokinetics, as I was talking about, which helps the movement of the muscle. Because of his lack of mobility, the muscles in the intestine are working slowly or sluggishly. It is very difficult to cure, but I think modification of medicine is probably what's required.
So you cannot get a complete relief, maybe moderately.
The relief will be there, but it won't go completely. I'm just being practical.
Good. Any more questions coming in? Any more questions coming in? Please ask questions directly because Dr. Saab is here for a little more while. We have held on to him for almost 1 hour and 25 minutes already. Any more questions? Please raise your hands.
Please, I have a question, please.
Yes, please ask.
Yeah, if a person is not passing stool on regular basis.
We can't hear you. We can't hear you. You're not audible.
Hello?
We can't hear you, please. We can't hear you.
Hello?
We can't hear you, madam. Any more questions? Next question. We can't hear you, madam.
Okay.
Yeah, you can. I can hear you now. Please.
Okay. Actually, if a person is not passing stool on regular basis and is not feeling constipated either, so is it okay or is it taking upon her health or something like that?
I'm sorry, I couldn't hear it very well. I don't know.
Okay, the person has not passed stool for 2 days and still not feeling is constipated definitely, and there is no problem. Is there any problem in that?
No.
That's what I could gather.
No. There is no. If there is no problem, it will pass. You can take a mild laxative and see. Some people's habits are different. A lot of people won't pass open your bowels every day.
So is it okay? You got the answer right?
Yes, yes. Thank you so much.
Good, good. Any more questions coming up, please? We have to wrap it up. He's here for 1.5 hours.
I have one more question.
Yes, please ask.
Regular gastric and acidity causes or increases arthritis? Yes or no?
It's the other way around. It's the other way around. That if you are taking anti-acid medication for a long time, that can affect your bones.
Okay.
Okay.
There's one more question.
Yeah, please ask.
I take 2 garlic pods every morning with water. So is it good for long term?
I have absolutely no problem you taking garlic pods.
To take avoiding antacids.
I missed the second one, but I've got no issues with garlic.
Okay. It just avoids taking.
No, question is that does garlic help? What is our question? Does garlic?
I take 2 pods garlic every morning with water. So is it good for long term as it helps me to avoid antacid tablets?
Doctor said it's okay.
That is okay to take, but I cannot say whether it prevents to take antacid. It is, I don't know. But you can take garlic pods. It won't do any harm.
Reflux can cause loss of sleep.
Yes, absolutely.
Yes.
Absolutely.
Can excessive gas be a sign of something serious? Yes, we already discussed that. Can gas give you headache?
Yes, it is not gas itself, but it's a side effect of excessive flatulence. So it can sometimes you will have somatic symptoms. You can have headache. Yes.
Okay, I have a quick question. I have been facing lots of gas and acidity since Saturday. My entire left side has been paining. Pain moves from chest, under the breast, bone, and to upper back to arms. I've been taking Nexpro RD and Mucane gel. I still have not got a relief with the pain. Any suggestions?
There's a lot of people within this lockdown era is getting your symptoms. So I can assure you there's nothing serious. Staying at home and people are getting quite worried and anxious about this. I think you're on the right medication. If the things don't improve, you can add on a Nexpro 20 in the evening in addition to RD40 and see. But this will settle down. This will settle down. You're on the right medication.
Okay, great.
There's one more question. Okay.
Yeah, please. Ask.
Yeah. Is it possible that gas gets locked in different parts of body and when you get a massage, it goes out?
No, it works in a way. It doesn't get anywhere. It doesn't get locked.
What is probiotics? Probiotics.
Massage helps you. Yeah, sorry. Yeah. Probiotics?
Yeah.
You want to ask about probiotics?
Yeah, the question is what is probiotics and what are prebiotics?
So these are beneficial bacteria. So our gut has got good bacteria and bad bacteria. So beneficial bacteria are often useful in certain cases of irritable bowel, especially in diarrhea predominant irritable bowel. So probiotics are often used, not in constipation, but diarrhea predominant diabetes is often helpful. It can help a bit in bloating symptoms also, but mainly for diarrhea.
So, but then they say that when you have probiotics, you save yourself from cancer issues or something like that. Is it true?
These are all anecdotal reports. I don't think there is any definite evidence that probiotics prevents cancer, but it's something to look out for.
Okay. And there's another one coming in. Is Amrit Dhara okay in mild of hot water? I don't know.
I have got no clue.
That's okay. Can we have more questions? Yeah, please.
Yeah, one more question.
Yeah.
As doctor said that one should go for colonoscopy after 50, but in what interval should we go for it again?
No. So if someone has got no family history of IBD, no family history of colitis, and no symptoms, and the colonoscopy is normal, you don't need to have many more. But there are guidelines coming in Western countries that get it done every 5 years. But again, for Indian situation, if you have got no significant family history and no symptoms, probably one-off is good enough for the time being.
Okay, great. Any more questions coming in, please?
All right.
Okay, Dr. Saab, can you please tell us how to contact you? Somebody wants to connect with you. Please give your number of a secretary or somebody who they should call.
Shall I send it to you? You can put it on there.
Or you can just say it. People note it down right now.
So I'll give you the number. So problem is where I go, it's usually at Park Clinic, but it's closed now. Their number is 7044446066.
I repeat, 70444
6066.
Okay, the number is 70446066, right?
Four fours.
7044446066.
Can you please write down there, Kavitaji?
Yeah.
And any other number you want to give, sir?
Fortis number, my secretary there, is 85850.
Yes.
30359.
Okay, you can write down this also, 85850 Okay, any more questions coming in? There is one interesting question which was given, which I did not get to that topic. What is cancer screening program?
That's what we talked about the colonoscopy thing, you see.
Oh, okay. I get
That's
it.
the program we're talking about. So if anyone has got a family history or
a 5BT or something, then he goes into.
So that's in colon, and you can do the similar thing for stomach endoscopy also.
So endoscopy. Okay, I get it. And what is this difference between the Crohn's? What is this Crohn's thing in the intestine?
So inflammatory bowel disease, IBD, which we discussed briefly, are two types: ulcerative colitis and Crohn's disease. So Crohn's disease is a condition, inflammation, which can affect anywhere from the mouth to the rectum. Okay. So it's an inflammatory condition.
Excellent, Dr. Saab. You've been wonderful. I mean, throughout the period, you've been so calm and answered so many questions. Hats off to you, Dr. Saab.
Thank you very much.
Nice to have you over.
Thank you.
Great. Anyway, since we are not having more questions, I think we should allow him to take some rest because we've held on to him for almost 1 hour and 40 minutes.
Thank you.
You've been very, very good and very, very calm. আমি তো এতগুলো শিখে গেলাম এখন মনে হচ্ছে আমি নিজে ডাক্তার হয়ে যাব তো
You take care. We'll talk later. Thank you.
Yes, Dr. Saab. Thank you so much. Thank you.
Thank you so very much, Doctor.
Thank you, sir. Thank you so much.
Thank you.
Thank you, Hemant. Thank you, Ravi.
Thank you, Jesse. Great show.
Thank you, Kavita. Thank you, Preeti ji.
Jesse, great show. Yeah.
One satisfactory and rest all good.
Jesse.
Yeah.
Yeah.
Can we cover?
I am not getting the details whenever the program is on. Can you also?
क्या बोल रहा है समझ में नहीं आता.
You can go to
He
the
is not getting the details.
Of what?
अरे जो प्रोग्राम हो रहा है अपना जो भी हो रहा है जूम में मीटिंग ये आ नहीं रहा मेरे पास मैसेज.
ये ग्रुप है हरीश व्हाट्सएप का ग्रुप है.
Please join the WhatsApp group. Please join the WhatsApp group.